Every 36 seconds, someone dies from cardiovascular disease, not from an accident, not from old age, but from a condition that often develops silently for years. If you think heart disease only affects the elderly or unhealthy people, stay with me, because this may change how you see your own heart forever. Why this conversation matters. Cardiovascular disease is the leading cause of death worldwide. It doesn't care about your income, your gender, or how busy your life is. It often starts quietly, no pain, no warning, until one day it becomes a heart attack, a stroke, or sudden death. In today's video, we're going to break down what cardiovascular disease really is, how it develops, why so many people miss the warning signs, and most importantly, what you can do starting today to protect your heart. No fear-mongering, no medical jargon overload, just clear, honest information that could save your life. What is cardiovascular disease? Cardiovascular disease is not one single illness. It's an umbrella term for conditions that affect the heart and blood vessels. The most common types include coronary artery disease, heart attacks, strokes, heart failure, high blood pressure related heart damage. At the center of most cardiovascular disease is one major problem: restricted or damaged blood flow. Your heart is a pump. Your blood vessels are highways. When those highways narrow or harden, the heart has to work harder. Over time, that extra strain causes damage and sometimes sudden, irreversible failure. How cardiovascular disease actually develops. Here's the uncomfortable truth. Cardiovascular disease usually takes years or decades to develop. It often begins with damage to the inner lining of your blood vessels. This damage can be caused by high blood pressure, high cholesterol, smoking, chronic stress, high blood sugar, inflammation from poor lifestyle habits. Once that lining is damaged, cholesterol and fat start sticking to it. This forms plaque. Over time, plaque hardens and narrows the arteries, a process called atherosclerosis. Blood flow slows, oxygen delivery drops, and your heart is forced to work overtime just to keep you alive. The silent danger, why symptoms are often missed. One of the most dangerous things about cardiovascular disease is that many people feel fine until something goes wrong. Some warning signs are subtle: shortness of breath during simple activities, chest tightness or pressure, not always sharp pain, unusual fatigue, dizziness or lightheadedness, swelling in the legs or ankles. Many people ignore these signs or blame them on stress, age, or lack of sleep. That delay can be deadly. A heart attack or stroke is often the first obvious symptom, and by then, damage has already occurred. Who is at risk? The truth might surprise you. Cardiovascular disease is not just a men's problem. It's not just an old person's disease, and it's not limited to people who are overweight. Major risk factors include high blood pressure, high LDL, bad cholesterol, diabetes or insulin resistance, smoking or vaping, obesity, especially abdominal fat, physical inactivity, poor sleep, chronic stress. But here's the part people don't like to hear. You can look healthy and still have serious heart disease. Normal weight does not equal low risk. Youth does not equal protection. Genetics may load the gun, but lifestyle pulls the trigger. A real-life story: when I'm fine isn't enough. Let me tell you about someone you've probably met before, maybe even someone like you. A 42-year-old man, working full-time, no major health complaints. He gets tired, but who doesn't? One morning he feels pressure in his chest, not sharp pain, just discomfort. He ignores it. 2 hours later, he collapses from a massive heart attack. No warning, no dramatic symptoms, just years of silent damage finally reaching a breaking point. This is why cardiovascular disease is so dangerous. It doesn't always ask for permission. How cardiovascular disease is diagnosed. Doctors don't guess when it comes to heart disease. They use tools such as blood pressure measurements, cholesterol and blood sugar tests, electrocardiograms, ECG, echocardiograms, stress tests, coronary artery imaging. If you've never had your blood pressure or cholesterol checked, you are flying blind. Early detection doesn't just save lives, it prevents lifelong complications. Can cardiovascular disease be prevented? Here's the good news, and it's real, not motivational fluff. Most cardiovascular disease is preventable. Not all of it, not always, but a large percentage of cases could be delayed, reduced, or avoided with consistent habits. Key prevention strategies include managing blood pressure, keeping cholesterol under control, maintaining healthy blood sugar levels, staying physically active, eating heart-supportive foods, quitting smoking completely, prioritizing sleep, reducing chronic stress. No single habit fixes everything, but small improvements done daily create powerful protection over time. What a heart-healthy lifestyle actually looks like. A heart-healthy lifestyle isn't extreme, it's sustainable. It looks like moving your body at least 30 minutes most days, eating more whole foods and fewer ultra-processed foods, choosing healthy fats instead of trans fats, reducing excess salt and sugar, managing stress instead of ignoring it, taking prescribed medications when needed. This isn't about perfection, it's about consistency. Your heart responds to what you do repeatedly, not occasionally. Treatment. What happens after diagnosis? If cardiovascular disease is already present, treatment depends on severity. It may include lifestyle changes, medications to control blood pressure, cholesterol, or clotting, medical procedures like stents or bypass surgery, cardiac rehabilitation programs. Treatment works best when patients are informed, involved, and honest with their healthcare providers. Ignoring the problem does not make it go away, it makes it worse. Why your heart deserves attention now, not later. People often say, "I'll start taking care of my heart someday." But cardiovascular disease doesn't wait for someday. The habits you build today determine how long your heart lasts, how strong it remains, whether it fails suddenly or supports you for decades. Your heart beats over 100,000 times a day. The least we can do is take care of it. Final thoughts. Take this personally. This isn't just health information, this is personal. Because cardiovascular disease affects families, not just individuals. It steals time, independence, and lives, often without warning. But knowledge changes outcomes. Action changes futures. If this video helped you understand cardiovascular disease more clearly, don't keep it to yourself. Like this video to support heart health education. Subscribe to Balanced Motion Health for evidence-based wellness content. Share this video with someone you care about, especially if you think they're too young to worry about their heart. And most importantly, take one step today. Check your blood pressure, go for a walk, or talk to a healthcare professional. Your heart is working for you every second. Now it's your turn to work for it.